14 million people have died across the world from pesticide suicides since the agricultural green revolution in the 1960s. 150,000 people die every year. That's up to 20% of global suicides. Worldwide, the commonest method used in non-fatal suicide attempts is self-poisoning. This video aims to present an overview of the current situation with pesticide self-poisoning in Asia. In particular, it will focus on the work carried out by the members of the Center for Pesticide Suicide Prevention, or CPSP, who have worked with local governments, healthcare workers, and affected communities for over 20 years to prevent unnecessary deaths from pesticide poisoning. They believe that this high number of deaths is affected by a few crucial factors. 1. The widespread availability of highly toxic pesticides in rural communities. 2. Their access to farmers and farming communities at times of crisis. And 3. Difficult medical treatment. However, research carried out in Asia has clearly shown that deaths due to pesticide self-poisoning can be prevented through a multifaceted approach. By improving medical management, working with affected communities, particularly pesticide shop owners, and banning or regulating the use of highly hazardous pesticides in agriculture. These 2 bottles of pesticide contain about 200 milliliters of liquid and cost around $10. They're used by farmers across Asia to protect their crops from disease and insects. If I were to drink this whole bottle, I'd be relatively unharmed. A tablespoon of this would kill me. "17-year-old Ruani died 3 months ago after drinking a highly hazardous pesticide. Sarath, her father, found her unconscious in her room. She died 7 days later in a hospital in the north-central province of Sri Lanka. No one appears to know why or what made her drink the pesticide. What we do know for sure is that the poison she drank killed her." So how common is Marshall 20?
It's really the most common insecticide seen to be being used now. It's responsible for about 40% of the deaths from pesticide suicides now in Sri Lanka. So it's the number 1 cause of suicide here in pesticides. And in these rural areas, pesticide poisoning remains a common cause of death.
The UK's National Health Service defines self-harm as an act of intentionally damaging or injuring one's body, often as a way of coping with or responding to overwhelming emotional distress. The intention is usually to punish oneself, to express distress, or relieve unbearable tension. Sometimes it's a mixture of all 3. What would you say was the biggest reason for self-harm?
I think the key thing to say, first of all, that self-harm is not suicide. The majority of people who self-harm themselves have no intention at all to die. They want to use it for communication. They want to tell people how they feel, that I'm angry today, that I'm hurt today, that what you did to me last week has shamed me, made me feel dreadful about things. And they do this act of self-harm in front of people to say, I'm in pain. That's what self-harm does, it communicates. Some people die, the great majority of people don't die. And the intention is not to die.
After he argued with his wife, Jayatissa was angry, frustrated, and wanted to teach his wife a lesson. So he decided that he would drink a bottle of pesticide to make her feel guilty for causing him pain, a knee-jerk reaction to a problem. There was no planning that went towards this act. He was angry and decided to do the one thing that would express pain and hurt his wife. The pesticide he consumed was not a highly lethal one. In addition, he had good care by doctors and healthcare professionals, so he was lucky and survived his act of self-harm. However, this could have ended differently had he, by chance, chosen a more harmful pesticide. Doctors working in Sri Lanka for over a decade say that medical management of pesticide poison patients has significantly improved in recent years. When little was known on how to treat these patients in the past, many lives were lost, particularly in rural hospitals because of the lack of medical infrastructure or support. This has now changed. Hospitals are better equipped to manage patients according to the pesticide consumed and its toxicity.
Our knowledge base has improved. Access to highly toxic pesticides have been reduced through regulation. Our management is better. And there are other things that are happening now, like health, public is being informed. The pesticide vendors have been educated how to pick up high-risk individuals. So lots of things are happening. So we're doing far better than the rest of Asia.
Many years back, we had very poor techniques of gas decontamination, and the practices of management was different. And we have now a better trained staff, from doctors to nurses. And I think because of that, the clinical outcomes have improved.
මට ඕන වෙලා තිබ්බේ මැරෙන්න. ඒ හින්දා මම ගියා කඩේකට ලස්සනට ඇඳලා තරහ පෙන්නන්න නැතුව දුක පෙන්නන්න නැතුව මං ගිහින් කඩේ අක්කාගෙන් ඉල්ලුවා අක්කේ මට තෙල් එකක් දෙන්න මෑ කරල් ටිකක් හැදලා තියෙනවා ඒකට සත්තු වගේක් ඇවිල්ලා ඉන්නවා ඒ සත්තු ටික මැරෙන්න එකපාරට ගහලා මැරෙන තෙල් එකක් දෙන්න කියලා. ඊට පස්සේ අක්කා තෙල් එක බලලා මගෙන් ඇහුවා නංගි ඔයා තෙල් ගෙනියන්න ඔයා වගා කරලා තියෙනවනේ කියලා. මං ඊට පස්සේ අක්කේ මම නාන තැන හදලා තියෙන්නේ ඒකට ගහගන්න අයියා කෙනෙක් ඇවිල්ලානේ අයියාට කියලා ගහගන්න කියලා. මම කරේ බොරුවක්.
පස්සේ මම බයික් එකේ අරගෙන පිටිපස්සෙන් ගියා. යනකොට මේ මකට එක්කෙනෙක් කතා කරලා හිටියා. පස්සේ මං ගිහපු ගමන් මේ ශනිකව තෙල් එක උතුර ගන්න බැලුවා.
මෙයාලා කොහොම හරි දැනගත්තා මම බොන්න ගෙනියන්නේ කියලා කට්ටිය යාළුවෝ හතර වටේ එකතු වෙලා මං අල්ලගත්තා.
ඊට පස්සේ මං එතන කඩේ අක්කට කතා කරලා එහාට එක්කන් ගියා අද්දින් අල්ලගෙන.
කඩේ අක්කා මං අරගෙන ගිහිල්ලා මේ ඒ අක්කලා ඒ කාමරේට දාලා මගේ ඇඳුම අසර අත දාලා අර තෙල් එක ගත්තා. අරගෙන ඉතින් අද මං ජීවත් වෙලා ඉන්නවා එයාලා තෙල් එක ගත්ත හින්දා.
One of the aims of the CPSP initiatives is to educate the community, particularly the pesticide vendors, on how to identify customers who might be at high risk of drinking the pesticide they intend to purchase to harm themselves. Vendors who have stopped people self-harming believe that the training they received enabled them to approach a vulnerable customer by asking the right questions or understanding their risk behavior.
මට විශ්වවිද්‍යාලයෙන් ඇවිල්ලා මේ ඒ පුහුණුවක් දුන්නා. මට ඒක ගොඩක් වැදගත් වුණා. මොකද ඒක බොහොම ප්‍රායෝගිකවම මෙතන මගේ ෂොප් එකටම ඇවිල්ලා බොහොම ප්‍රායෝගික පුහුණුවක් දුන්නා.
For every person who dies by pesticide suicide, at least 20 have drunk pesticides in self-harm and survived. This means that almost every farming household knows someone who has tried to harm themselves, someone who has died from pesticide poisoning, or has attempted it themselves.
ජීවිතේ බේරෙයි කියලා විශ්වාස කරන්න පුළුවන්.
Therefore, getting the message across to the community, the vendors, farming families, and governments about the dangers of highly hazardous pesticides is central to CPSP's work. To carry out this work, researchers travel long distances daily to meet families and gather their stories. Often these are people they've seen in hospital as well. Sandhimali and Kalpana have been working with the Centre for Pesticide Suicide Prevention in Sri Lanka for over 7 years. Between them, they have met and interviewed over 5,000 families, many of them affected by self-harm. They say that often they feel quite helpless and distressed considering the magnitude of the problem.
එක සිද්ධියක් මට හොඳටම මතකයි. මම බේස්ලයින් ඩේටා කලෙක්ට් කරන කාලේ ගෙදරකට ගියා. දුප්පත් ගෙදරක්. එතකොට හිටියේ අම්මා කෙනෙකුයි තාත්තා කෙනෙකුයි. එතකොට එයා ඇඳේ ඉඳගෙන මට පුටුවක ඉඳ ගන්න කියලා කිව්වා. ඊට පස්සේ මම ඔය සෙල්ෆ් ෆාම් ප්‍රශ්නේ අහනකොට එයා කල්පනා කර කර ඉඳලා ඇඳෙන් නැගිට්ටා. නැගිටලා ඉවර වෙලා ගෙදර දොර උළු කියන්නේ දොරකඩ ගාවට ගිහිල්ලා උළු අස්සෙන් එහෙම අත තියාගත්තා උඩට. අත තියාගෙන කිව්වා මගේ පුතු 3 දෙනෙක්ම මැරුණේ වස බීලා කියලා.
ඇත්තටම ගත්තොත් කේස් ස්ටඩි සෑහෙන ප්‍රමාණයක් තියෙනවා. මගේ එක්ස්පීරියන්ස් එකක් එක්ක මට තදින්ම දැනෙච්ච එක දෙයක් තියෙනවා. අපි දවසක් පේෂන්ට් කෙනෙක් වස බීපු පේෂන්ට් කෙනෙක් එයා සර්වයිව් වෙනවා. ඉන්ටර්විව් කරන්න ගෙදර ගියා. ගෙදර ගියේ හවස 7ට විතර. මොකද උදේ වරුවට පේෂන්ට් නැහැ. එයා ජීවත් වෙන්නේ කුලියට පොල් කඩලා. අපි ගිහිල්ලා ඉන්ටර්විව් කරන්න යනකොට ඇත්තටම කිව්වොත් එයාට චූටි බබෙක් ඉන්න අවුරුදු 2ක. පේෂන්ට් තමයි බබාගේ තාත්තා තමයි වස බීලා තියෙන්නේ. ඉතින් අපි යනකොට ඇත්තටම පොඩි කුප්පි ලාම්පුවක් පත්තු කරගෙන ඒක තියාගෙන පොඩි බබත් එක්කම පාන් කනවා. ඇත්තටම දැකපු ගමන් දුක හිතෙන සිද්ධියක්. ඉන්ටර්විව් කරන්න එළියක් නැහැ. අපි ගිහපු බයික් එකේ ලයිට් එක හෙඩ්ලයිට්ස් වලින් තමයි අපි ගහගෙන ඉන්ටර්විව් කරේ. ඒක මට සෑහෙන්නම දැනෙච්ච අවස්ථාවක් තිබුණා. නමුත් රිසර්ච් එකේ අපි සාමාන්‍යයෙන් ඩේටා කලෙක්ට් කරන කට්ටිය අපේ තව ගොඩක් රිසර්චර්ස්ලා ඉන්නවා. ඒගොල්ලන්ට මේ වගේ අවස්ථා දැනෙච්ච අවස්ථා තියෙනවා. අපි සාමාන්‍යයෙන් මාස 3කට සැරයක් ඒගොල්ලන්ට මයින්ඩ්ෆුල්නස් එකක් දෙනවා. කෙනෙක්ව ගෙන්නලා මාස 3ට වගේ අපි එහෙම දෙයක් කරනවා අපේ ඩේටා කලෙක්ටර්ස්ලාට. මම හිතනවා එකෙන් ආපහු ඒගොල්ලෝ රිෆ්‍රෙෂ් වෙලා එනවා කියලා.
Having seen people harming themselves for many years, the CPSP team believe that the long-term solution to prevent suicide would be to improve the economic and psychosocial situation in these communities. But this, they say, will require time, education, and the willingness to unlearn old ways of dealing with stress or a crisis.
ඒ වෙනකොට වහස නොතිබ්බනම් සමහර විට ඉන්නේ උන්ට ගහලා බැලන හරි ඒක කෝපේ එතනින් ඉවර වෙනවා. ඒක මම අර වෙලාවෙත් කිව්ව එකයි අර ඒ වෙනකොට විනාඩි 10ක් අපිට කාලේ තිබුණා නම් සමහර විට මම මෙතන රණ්ඩු වෙලා මේ වෙනකොට අර පළහරිය වහයක තිබ්බනම් මම එතෙන් යනකොට ඒ අදහස වෙනස් වෙනවා.
We analyzed recent data, I mean not recent data, actually 10 years data. Then we realized that the pesticides are easily accessible for self-harm. So if farmers lock their pesticides away, maybe a chance to prevent them for going for self-harm. So that's the fundamental basics behind the safe storage.
The Centre for Pesticide Suicide Prevention set up a huge study in 2010-2011 to explore whether giving households lockable containers would allow them to store pesticides more safely, reducing access at times of crisis. Over 56,000 households were recruited, half of which received a specially designed container for storing pesticides.
There have been studies on that if you store it away from your home, then by the time you go and get it, you kind of get over that impulse to kill yourself. But somehow that's not what's happening in India.
Unfortunately, in Sri Lanka, the pesticide container study also did not show any benefit, and the rate of pesticide self-poisoning did not fall.
Look at the data for 3 years. At the end, we realized that there's no any effect for the self-harm prevention. Maybe simply device not, storing pesticides maybe not the practical way for farmers in this community.
For now, the CPSP team believe that the best and surest way to save lives is by regulating highly hazardous pesticides. This way they are not used in agriculture and therefore no longer stored in these rural households. If all the pesticides used in agriculture are relatively non-toxic to humans, people will no longer die of this poisoning.
So, has it been easy to regulate toxic pesticides or not?
Well, Sri Lanka has been the country that's done this most successfully. By systematically trying to identify which highly hazardous pesticides are causing most of the suicides, they've been able to find alternative pesticides or alternative forms of agriculture, like of crop protection, and have managed to ban systematically those pesticides that cause most of the deaths.
In the 1980s and 1990s, several highly hazardous pesticides were banned in Sri Lanka. This resulted in a marked fall in pesticide suicides that started in 1995 and has continued to this day with further bans. These regulatory actions have seen a 70% reduction in pesticide suicides in Sri Lanka since the 1990s, saving an estimated 93,000 lives.
If you take the cost of a pesticide bottle, it will come to about 300 to 500 rupees. But asymptomatic pesticide poison patients may need 100,000 to 500,000 with the present situation in the Sri Lankan hospitals. So it's really a huge cost to our health budget.
If we think in financial terms, by banning a highly hazardous pesticide and saving just one life, it would cost the government only about $50. This is incredibly cost effective, a saving for the healthcare service who no longer need to use intensive care units to treat seriously poisoned patients, who may take up to 7 to 14 days to revive or lose their life. But some farmers worry that the various bans would reduce agricultural productivity. The centre, having looked at this aspect over 20 years, says that evidence so far suggests that the bans of highly hazardous pesticides does not reduce crop yields.
So from a regulatory perspective, the Chinese have been really successful. In about 2002, they identified 5 or 6 pesticides that were the most problematic ones in China, and they regulated them and banned them. And that was built up over 5 years, that by 2007, 2008, they were no longer available. And the numbers of deaths have clearly come down in China. I think partly as a result of that, and partly a move from the villages into the cities where there's no more pesticides available. Other countries like Bangladesh have done the same thing, and in South Korea as well. But there's also the environmental problems of pesticides, there's the pollinator problems, there's the natural enemy insects. So actually there's a bigger picture here of which pesticides can we get rid of which are causing problems with those.
Regulating highly hazardous pesticides works from multiple perspectives, as seen in Sri Lanka, Bangladesh and South Korea, where deaths have fallen dramatically with bans of highly hazardous pesticides with no harm to agriculture. However, although legislation and bans have been relatively successful in some countries, the execution of bans has had varying success in others.
Till the time you get it out of the market completely, or till the time you eliminate the end user from using that particular pesticide, there will be people who would be manufacturing it, there will be people who would be selling it just because the demand is more. So you need to break that demand supply chain for the highly toxic pesticide.
In the 1990s, China had around 180,000 deaths from pesticide suicide each year, almost 500 deaths a day, or 1 every 3 minutes. After the ban of 5 highly hazardous pesticides in the 2000s, the numbers fell from 500 to 140 deaths a day. That's about 50,000 deaths a year. While this is still a high number, it is nowhere close to how it used to be. Although no one can be certain about the reason or reasons for the fall in numbers, what we do know is that deaths due to pesticide suicide have reduced dramatically in China, and this has coincided with pesticide bans carried out by the government.
Ideally, self-harm should be prevented by stopping men and women from drinking poisons of all kinds.
But the more efficient, quicker approach is to regulate the distribution of highly toxic pesticides, making self-harm safe. This, researchers say, is like taking safety measures to keep motorists safe on the road, making cars safer or enforcing stringent laws and fines. So they argue that self-harm with pesticides must also be considered as an act that can be controlled by regulations.
මහත්තයලම කියන්නකෝ මහා මෙරක් වගේ දුක් විඳලා හදාගත්තු එකාට ඉන්නේ ඔච්චරද කියලා නෑ මං අහන්නේ මෙච්චරම මේ සොච්චන් ගන්නකට ඔච්චර ලේසියට මහත්තයෝ මුන් ඔය අහුවෙච්ච එකක් කටේ හලාගන්නේ මැරෙන්නම නෙමෙයි බය කරන්න.
Banning highly toxic pesticides saves lives. It's the quickest, surest way to stop people dying. To stop suicides, usually those who survive self-poisoning, as a suicidal or non-suicidal act, do not make a second attempt. It allows them to see their family, their friends, their doctors, to get some resolution to their problems.
වසබීලා ඒ වුණාට පස්සේ ආය කවදාවත් එහෙම හිතිලා නැහැ. අඩුම තරමේ ගෙදර ප්‍රශ්නයකට හිතුණත් ආය ඒ වගේ මෝඩ වැඩක් කරන්නේම නැහැ.
The purpose of this film is to stress the importance of effective management and regulation of highly hazardous pesticides. As we have seen from studies across Asia, regulation of highly hazardous pesticides has not reduced farming profits. However, it has saved lives.
හෙට දින නුඹත් දීගක ගිය පසු නෑනේ මාසේ පෝයදා වාගේ ගම්මානේ